My name's Krista Conway, and for my case report project, I will be doing diabetic ketoacidosis. Signalment. My patient's name is Pongo. His species is a canine. His breed is a Dalmatian. His age is 3 years old, and his sex is an intact male. The presenting complaint. Pongo's owner claims that after moving homes, he has been lethargic and refusing to eat for the past 48 hours. He has also been urinating more frequently. This morning, Pongo began wheezing while breathing. History. The medication Pongo is on is Trifexis, which is a parasite prevention. He's an indoor dog. His diet is Hill Science Diet Large Breed. He's a bit underweight. He has anorexia. He has polyuria and polydipsia. And he also has stress. Physical examination / observations. Pongo's weight is 38.5 pounds, which is pretty low for a Dalmatian. His body condition score is a 3 out of 9. General appearance appears calm. He is panting excessively. His eyes is clear, no discharge. PLR, pupillary light response, is normal. His ears have no discharge and no odor. Dental, no missing teeth. He has a slight odor and some plaque and tartar present. Integumentary. He has a smooth coat, no lumps or bumps, no lesions, and his lymph nodes are not enlarged. Continued. Genitourinary, no discharge, no odor. Musculoskeletal, normal gait. He does have slouched posture. His mucous membranes and capillary refill time. His mucous membranes are light and pale in color. They're tacky, and his capillary refill time is a little bit more than 2 seconds. This means that he is dehydrated. Alimentary / GI. Anorexia and abdominal pain. Circulatory, he has a slight murmur. His heart rate is 60 beats per minute. Respiratory, he has labored breathing. He is coughing a little bit, wheezing sounds, and his respiratory rate is 50 breaths per minute. And neurological is a little bit dull. Problem list / differential diagnosis. He has anorexia, polyuria, labored breathing / wheezing, high respiratory rate, dehydration, a heart murmur, low heart rate, lethargy, diabetes / DKA. Diagnostics. Complete blood count / chemistry profile, urinalysis, and urine culture. Pongo's owner wanted all tests to be performed. Sedation and anesthesia were not needed. Results learned that Pongo had anemia and a high blood glucose level of 500 mg per dl, hyperglycemia. High levels of glucose and ketone bodies were found in his urine. Final diagnostics. The veterinarian's final diagnosis was that Pongo had DKA, diabetic ketoacidosis. Hyperglycemia, high blood glucose levels, and anemia occur in almost all dogs with DKA. Since Pongo's diabetes were left undiagnosed, DKA was resulted. Treatment plan. Pongo was monitored on lactated Ringer solution fluids for approximately 6 hours to see if his glucose levels would drop. Insulin therapy through IM injection. Blood glucose is to be measured every hour. Pongo is recommended to stay overnight in the clinic. Outcome. Pongo responded well to treatment and was able to return home the next day. DKA is a life-threatening disease, so at home, Pongo will need proper insulin dosing and monitoring of blood glucose levels daily. Conclusion. DKA occurs when there is not enough insulin in the body, resulting in high blood sugar / glucose levels. This is a medical emergency. The body creates ketone bodies, which increasing can cause a shift in acid / base balance in the body, meaning the body can't maintain appropriate fluid balance. This can all lead to heart arrhythmias, abnormal muscle function, and even death if left untreated. Pongo's condition is suspected to have been brought on by stress. Reoccurrence is common, so it is critical that glucose levels are monitored at home. Discussion. There is no limitations as Pongo's owner was willing to do all the recommended testing and treatments. Pongo did not suffer any complications as he was brought in at first signs of illness. If his owner would have waited longer, complications such as heart failure, liver failure, or fluid in the lungs could have occurred. And these are my references, and that's it.